The cloud. Okay, thank you so much for joining us again. My name is Brittany Doyle. I'm the founder of Wise Health SF, which is a public health consulting company located in the beautiful San Francisco, California. I am working in collaboration with the Department of Status on Women, and we are bringing to you Free Your Mind SF, which is an amazing media campaign bringing light to mental health awareness, increasing access to education, resources, and treatment within marginalized communities in San Francisco. For this campaign, we have a series of events scheduled across San Francisco that are going to take place in the fall. And we're also sitting down with a few leaders that are working, developing, and innovating to address mental illness in San Francisco. Like the wonderful Claudia Parada here, she is an expert therapist that empowers young first generation Latinx and BIPOC individuals to decolonize their body, mind, and spirit in order to tap into their true selves. She is unapologetically centering professionals of color in her work in order to make the most impact in reimagining the way we heal together in today's world, which is something very important. A San Francisco Bay Area native, she's a graduate of San Francisco State University, getting her major with a major in Latinx studies and a master's degree in integral counseling psychology from California Institute. Why is it so hard for me to say? California Institute of Integral, am I saying that word right? Integral Studies, training in humanistic approaches to therapy. Thank you so much. I'd like to introduce you, Claudia.
Thank you, thank you. Thank you for that beautiful welcome, and
Kind of butchered it
your
up.
work no, you're amazing. Your work is so inspiring, and I'm just so excited to be here, so thank you for inviting me.
Thank you. Thank you. I'm excited for this wonderful conversation that we have planned for our listeners today. But let's start and learn a little bit more about you. Can you share your journey and what inspired you to become a therapist focused on the Latinx community?
Yeah, of course. I mean, it's such a big question, so I'm definitely gonna try to distill it and give you the highlights. In short, my first career was in banking, and Um, I was there, I thought I was gonna be there, like, my whole life, like my mom, and at one point, I got really sick, burned out, and was hospitalized with an autoimmune condition, and my whole life turned upside down. I was like, "Okay, I can no longer do this job. No, nor do I want to." So then I was kind of left with this question of what next? So in this experience, I realized how disjointed our medical system is because I was really wanting a holistic approach, not just physical medical care, but spiritual, psychological, emotional care, whole person. And I felt like it was very disintegrated. And so for me, I thought I'm a person that loves to hear people's stories, to witness people and to really hold space for them. And so as I journeyed through my own healing, I was like, "Okay, if I can do this and if I can turn it around, because I've been in remission now for a while from my autoimmune condition." And so I thought, "Okay, if I can hold it like this and people can support me, then that's what I wanna dedicate my work to." And I think it's especially important to have shared identity in certain spaces to for that healing work to happen. Because like, I needed evidence, like, are there other women, are there other Latinas and child of immigrants that, like, are out here trying to do this work and kind of, like, decolonize and look for ancestral medicine and hold space for their emotions and physical well-being? So, that's where that was born from. So, I went back to school and I became a therapist, and I was like, "Great, that's what I wanna do." So, that's how I kind of landed at this work.
Nice. Now, did you find a lot of resources or a lot of people that provide what you were looking for? Because I know when I think about in San Francisco, like the Mission District is like one community that is so rich in culture, so rich, probably one of the richest here in San Francisco in
It's so
culture.
rich.
Were you able to find what you were looking for, that cultural level of healing?
I think I would say eventually. Yes.
Mhm.
So I grew up on the peninsula, and part of this journey was because my parents really pushed for assimilation. That's kind of like the story of a lot of immigrant families. So they
Mhm.
migrated from Nicaragua. Yeah. So they really were pushing high standard, like not high standard. What am I trying to say? They really wanted me to like go for what they thought was the best education and really kind of pushed me to be as close to proximity to whiteness as possible. And it was difficult to kind of come to a reconciliation point about like, I had the journey that I had, but I want something else. So, in that, it was like from my position, it was difficult to find because I would go to the hospital when I was sick,
Mhm.
which is like obviously a fair and obvious choice. But in that wanting more, I'm like, where can I find ancestral medicine? I don't know where to look. And I can't ask my mom, who has been a Catholic her entire life, because she's going to be like, what's that devil's work that you're trying to do? So I really wasn't sure where to turn, but it was actually at San Francisco State where I really felt like, oh, there are so many other Latinx students and we have similar stories. And in sharing our stories and experiences and connecting through relationship, and going into the community, organizing together, working at the medical clinic that we worked at, that's where I began to get even more exposed. So yes, it was here in the Mission actually, where I really felt like, oh, like this is where I not only become nourished, but can also pour from that cup.
Yeah. Yeah. Now, what are some of the most rewarding aspects of the work that you do?
Well, I think um I think there's a point where that one reaches if you're hoping to change, like, and similar to me, you become so tired of the way things are. And that's a point where it feels very hopeless. And so I think when people come to work with me, they're kind of like at a version of that point where they're like, I really want to change. I don't know how. I don't know how to reach for these things. And because we have not only like our internalized value system of what society and our culture says to how to behave, how to relate, how to take on these responsibilities that aren't necessarily ours. You feel like you can feel really constricted, which I think is honestly what happened to me. Like I'm like, oh, I have the job. I did the school thing. Like I'm supposed to be happy. And that's actually not true, and part of that is because, like, maybe that's not actually what you value. Maybe that's not actually how you wanna move through the world, and from there, it looks and feels hopeless, but then when we start to do the work and uncover, oh, you can have your own you can value your culture and your cultural values, but you can also do it in your way, and so kind of, like, breaking free from subscribing to some of those things, um can bring on autonomy and agency and relating to people differently and relating to the world differently. So supporting people and finding their own answers and finding their own way and taking action around it, I think like that is some of the most rewarding. That is the most rewarding feeling to be like, oh, like I saw you start here and then go for it, especially when folks don't believe that it's possible. Like, wow, you did that, you know? And I'm like, wow, I get to hold space for that. Like,
Yeah.
I can't believe it. I'm like, I can't believe I get to do this. Hmm.
Yeah. It's like what I'm hearing is it takes a level of unlearning, that you have to go
Definitely.
be open to doing, releasing a lot of cultural pressure, society pressures, just to get to that place that you want to be.
Definitely.
And with that, what changes or improvements would you like to see in the mental health field? Like how can something like that be integrated more, talked about more, accepted more? The
Yeah.
unlearning, because some may think that that's just so disrespectful. Why would you wanna? unlearn, that some of the ways of your parents or your community.
Yeah, absolutely. I think that's something that I deal with, and I think we deal with coming from a collectivist or community-oriented people, right?
Mhm.
So, I've had my mom straight up be like, "Well, that's selfish." Right? And so then there's conflict and also, like, all the feelings that come up around guilt and potentially, like, abandoning or being abandoned by your people, right? So, I think there's a lot of things that I would like to see change, and I think change is coming, but of course, there's still like, there's a lot of stigma around needing help, asking for help, um, saying, "I'm seeing a mental health professional." I know we definitely still hear in our immediate community, like, "Oh, you have a mental illness? Well, then you need to go to work, or maybe you need to pray." And while work can provide with a sense of purpose, and of course, prayer and spirituality is very important, there's also this additional piece of like, there are real tools, skills, and medicine that can really help support a person if there is mental illness or distress present. And so I would really like to see some of those more difficult conversations continue throughout our families and our communities. And I see it happening. Like I see our elders come and circle up and be like, I really want to be different because I'm seeing the impact of the relationship on my kids. So there's like a spectrum there. So there's that. And I will say structurally,
Mhm.
it's also important for our medical system to also acknowledge that therapists and mental health professionals really need like a full integration into the insurance, into the it just we need access just like across the board for people and not because they're like not only because they're depressed. I feel like people should have access to a therapist if they want it, at any point. So,
Right, with no qualms about it. I mean, now it's like you
yes.
try to, access a therapist through your insurance and, it may take 60 days for them to get
Yes.
back to you or approve you or even get you to the next level of the selection
Absolutely.
process, and by then people, have maybe, gotten used to their condition or, maybe it has passed. I always
Right.
think about my grandmother. She had maybe the biggest house in the family. I'm not sure. But whenever someone in our family was in mental health crisis, that person would be sent to my grandma's house. My grandma would send them to the back room with a Bible. They would just stay back there until whatever it is that they were going through would pass. And so my grandma would, bring them food, prayer or whatever, but you knew that what that back room was for. You know,
Mhm.
to care for, someone that was going through, whatever it was. I never knew what it was, but I knew it was
Right.
something.
Yeah, like the what what I'm hearing you say is like it's hasn't been identified. It's not necessarily openly talked about. There's a lot of shame. I'm not sure if this is your family's experience. I'm not naming, but these are like general themes that I've seen.
Locked in
Like,
the back room. So
yeah, go to the back room, pray, um, and of course, again, not to diminish or devalue those things because they are important, but like, what about the support of your immediate community and your family so that you are witness in the experience that it is that you're going through? Yeah, like that's so important. And if your family's like, oh no, we're going to talk about that. Like it really is like the song, We Don't Talk About Bruno.
mhm.
Like we're just, and he was living in the walls, right? So
It's
it's
Bruno.
so, I mean, it was a very real
Mhm.
it was a very real symbolism of like what actually happens in our communities. Cause like, oh, we don't talk about that person. They're just different. They're just
Exactly.
going through their own thing.
Exactly.
Mhm.
Exactly. I was listening to a podcast today. They said that the Latinx community is the largest minority group in the country. And then we were, before we got on this call, we were talking about some data that more than half of Latinx young adults, so we're talking ages 18 through 25, but this also could be inclusive of, just adults across the board. That more than half of young adults with serious mental health issues do not receive treatment. And it's due to barriers that include cultural stigma around, of course, mental health, language barriers, and the lack of cultural competent providers, which is, a whole nother issue in itself, across the board, whether you are a Latin, African American, Asian, you're always going to be faced with providers that just don't understand you or where you're coming from. And so, that puts us in the mindset that we have to have an equitable approach to
Absolutely.
healthcare across the board. And so, what does that look like for you? What does health equity in the Latinx community look like for you, especially with what you see with your clients?
Yeah. I mean, I really appreciate that question. I mean, thinking about having so I think the thing that comes up for me is cultural humility. So instead of framing it as cultural competency, thinking that I can learn as much as possible about someone's culture and then I then become the expert
Mhm. Yeah.
is in and of itself kind of an issue, right? So thinking about it from this frame of humility of like, there are things that I know, but then there are also things that I'm not going to know. And I'm going to approach it with that beginner's mind. Like, I know what I know about mental health, and I know what I know about my experience as a Latina, but that doesn't necessarily mean that I'm going to know what your experience is as a woman of color or even for another Latina, right? So that's my expectation of our providers as well, because our our society really lifts up our medical professionals as you're an expert and that's their status. But I would really like to see there be a change and a shift in that approach as to, okay, like you're really going to need to come to the table. Like there are things that I don't have an understanding about. And culturally, that's going to be really important. Um, because one of the things that happens with Latinx communities is that there's a mistrust in the medical system, rightfully so, especially given the history of this country. Um, and like, who wants to be pathologized when you begin to talk about these like experiences that you're having culturally that are normal? Like, who would want to be pathologized for that? Um, that many people come to me when they come to me, they say, like, I really do want to work with the Latina because I want to trust that you're not going to be judging some of the things that I say about my family or about my experiences like they're bad or wrong.
Mhm.
hmm
Great.
and then the other thing that I'll specifically say about that is like when you're going to a provider that does not have a lived experience of coming from a collectivist or community oriented culture, like there's and in therapy, like Western psychology in general, there's a focus on like just you.
Mhm.
You need to get better. Here's what you need to do. Like, here's your diagnosis. It's just you and me. And and this goes beyond like culture and color, but is a really important piece that needs to be acknowledged around you are a person that exists within a context. Your whatever mental health issue that you're experiencing, it doesn't happen in a vacuum. So it's not actually just me and you in the room. You are a context and a product of your environment, of your family, of your histories. And that's something that needs to be considered um, as well.
Comprehensive.
Yeah, definitely like looking at the whole picture. Yeah. So trust is super important. Like listening, trust, in that relationship. And like what I mean is like really, really listening to the people who are coming in, right? Because like that relationship building and that trust building takes time.
Yeah, that's very true. Um, and there's also, what I experienced working in the African American community is like you it's the knowing that it kind of goes into what you were just saying too, that there's so many different factors that impact a person's level of illness, their behaviors, their ability to address the behaviors. Um, so it's like if I go into the community and tell someone, to get here's some information to get you well, but they're like, I also need to pay rent. I also need to, I don't have any food in my refrigerator. I don't have anywhere stable to live in order to get well. That is, an ongoing conversation that I hear housing, being a main factor of why people can never just get stable across the board, whether it's, in their healthcare, jobs, just with life, period,
Absolutely.
such a huge
Mhm,
factor. Now, have you seen that, within your clients, the impact, especially in San Francisco? I'm sure you see clients from all over the Bay Area, but of
mhm.
course, we're talking about San Francisco here.
Sure.
But um, does that come up a lot, like the impact of housing instability? And do you have any suggestions? It's a two-part question.
Yeah, no, yeah.
The housing
So,
instability and how do people like go about addressing that?
well, I mean, I think that's a really important question. I would say within my clients, it's not necessarily, I think the thing that you're trying to speak to of like if you're experiencing housing instability or
Mhm.
food scarcity at like you're either going to have it or you're not, like that is a level of chronic stress that we're not going to sit here and talk therapy and be like, now let's talk about your childhood. Because while those things are important, I'm not going to then offer that type of service because you're going to go back out and still experience the same level of chronic stress. You can have therapy, of course, but like we really need to get other resources pulled so you're feeling foundationally stable because those are basic needs that need to be met. Um, what I w- what so in my client caseload, what sometimes happens is, okay, I really want to get my needs met, and the level of stress that happens at work because they have such a high cost of living and further housing, then they feel like, okay, well, now I feel like I can't leave because then what happens? Right. So I think it's um not exactly to your point, but definitely like in that ballpark. Because then you're again kind of feeling stuck, right? So I'm in a job, for example. So this would be like a hypothetical client in a job that is working them many hours, feel like there's no work life balance. It's impacting their mental health, it's impacting their relationships. Um, and really like the ability to like get their footing to be well. And then they feel like, okay, but I can't leave because I have to pay for this, this, and this. Yeah. Was there a second part to that question? Did you say like, well, then what can be done?
Yeah, so, how are you seeing, so of course the answer is, oh, people just get housed, people eventually will get an apartment.
Hmm.
Um, until that time comes where, there's the housing instability, um, people are in need of, care,
Hmm.
services. Um, have you seen where there's organizations that may support people during that time, or maybe there's a need for some sort of supportive service for people that are houseless, more supportive services or culturally responsive services for people that are homeless. And I'm just curious, have you seen, uh, you know, anything around that, or just even with your clients where, not necessarily homeless, but just maybe some instability while they're trying to keep up with their care?
Yeah. I mean, I'm thinking at like at the history that where I've worked at the community level. So I'm thinking back to those experiences and like there really are competing priorities. So, and they're very real competing priorities. So, as a caseworker who's trying to get this, trying to support my client to get to their appointment, and then they either have to work or like they're looking for the next place that they're going to be able to feel safe, or they're trying to get into a navigation center, or have to wait in line at the shelter so they can get in. So basically all these different things. And then have to remember, like, I have an appointment on this day and I have to actually get myself there and then sit through this appointment with this doctor who's trying to help me feel better. To me, it would feel like to then ask them, okay, now we're going to start therapy. Um, it does, it doesn't really feel like it's fitting, aligning to that need. So the way that I look at that is what really is important there is a continuity of a relationship.
Mhm.
Like, so we're going back to that trust piece. And that is in and of itself therapeutic, but like support to get these other needs met is going to be the number one thing that I'm seeing. So if you're houseless and you're trying to find housing and you need food and to get medical care, that's going to take precedent over sitting in a Zoom, or like sitting in an office, like talking about, you know, different
Neat.
things therapeutically. Yeah. So, I mean, and that's kind of like where case management comes in and the coordination.
Yeah,
Um, but
collaboration.
that continuity of relationships, sometimes it was like, that's all that's available right now within this dynamic. Like just me checking in on you and seeing like, what do you need? Can I give it to you? Will this be available? Does that make sense?
Yes, absolutely. Yeah. And it just also just speaks to, and I heard you say something earlier about the collective, but, or you mentioned collective, and I think that's just where my mind went.
Mhm.
um, you know, sometimes the need to always just work in collaboration with others. There's always going to be situations where, it's just therapy. People can afford just therapy. They have their life together and, they're just working with a therapist. But a lot of times, it's always good for a therapist to work in collaboration with others just to make sure that there's a comprehensive, to form a collective.
Um, I
Be a part.
really like that. Yeah, that's really like as part of a care team,
Yeah.
right?
Mhm.
So that makes I love that idea. It wasn't even something that occurred to me, but I know that there are teams that like bring in multiple providers from across
Yeah.
from across, oh, what's the word I'm looking for? Disciplines.
Spectrum.
Yes. Mhm. So necessary because the way that I conceptualize things and the way you conceptualize things as having a master's in public health is probably going to be different, but necessary to really begin to integrate like these things that really do actually need to be integrated. Like we don't, I mean, I might ruffle some feathers, but I don't know that we need to be highly specialized.
Mhm.
I guess I'll caveat that with we get to be highly specialized, but then also be open to collaboration, which is like I think so, so, so key to your point.
Yeah. And I don't know, I just feel like that's just something, I don't know if it's specific to San Francisco, but, as we talk about like equitable approaches, I find that when I do a lot of health equity work, no matter the economic level, whether it's low income or, high, moderate, whatever, I'm always having to, I can't just come by myself with education. I need to bring, healthy food. People still need to be educated about eating right or,
That's right.
housing information, because even though they live in a big house, they can't pay the rent. It's all these different things that I still have to bring with me, to address it.
Absolutely.
And so just thinking about that, I also wanted to talk a little bit about addiction as well, which is another issue here in San Francisco. So we've talked about the housing instability, and then there's the addiction issue as well. They always go hand in hand,
Mhm.
but sometimes they don't. And just having a better understanding of the issue, how prevalent are addiction issues within your the people that you work with now? Just hearing now about your client and experiences, I'm just wondering, how often are you faced with addiction, and what are some of the commonly used substances that you're hearing about right now?
Oh, I mean, that's such a great question. I would say within my okay, let me expand my perspective because I have one-on-one and I have group. So, I mean, I'm not an addiction expert, so I'll say that. And what I have seen is um alcoholism for sure. But in regards to other substances, I think that's something that I see usage um more peripherally, like not necessarily within my clients. So this is like in my community, I see it. Um, and that's uh using meth
Mhm,
and cocaine.
mhm.
And so as far as like use of fentanyl, that's not something that I've personally been exposed to like in my immediate community, but obviously we know that it's out there.
Yeah. Mhm.
Um and oh, and of course, I mean lots of marijuana use, I think. But I mean, I don't know that I would I don't know that I would categorize all those things the same way. But I'm thinking about addiction, I'm thinking about usage, frequency, intensity, and then the impact. And so that's what I'm really thinking about like when like substance abuse or like a really like is different from usage, right? So those are the things that I really like I feel like I see mostly in my client work, I see mostly alcohol usage and abuse. And then we'll when folks are ready to explore and talk about if they want to change their relationship to alcohol, that's what we're gonna work on that, of course. Mhm.
And then when it comes to like the treatment options, are you seeing options that are culturally responsive? Are we providing that? Is the city providing that? Um, the cultural aspect to overcoming addictions, if that's even a thing or a need.
I mean, I definitely think it's always important to consider culture no
Mhm,
matter what. Like, it's always considering the context of the individual in front of you is going to be really important. Um, so, but as far as the treatment options in San Francisco, I I'm just having a hard time understanding when like what happens when people get into treatment, I think. So I think the points of reference that it is that I have maybe are dated.
mm,
But I know folks that have wanted to get into treatment, and so this is expanding also, like, outside of the San Francisco and just in the Bay Area, who wanna get into treatment, and
mm,
then it's either it's not available or, like, it becomes something that is very difficult to sustain if it's outpatient.
mm.
So, like, the level of integration, um, is challenging, and especially when somebody then goes home and their family is not understanding, like, what is happening, um, and just really can't support them.
Yeah, I can definitely see how that can be hard. Just doing like research for what's here in the city, I see that there's a lot of outpatient
Mhm.
options, not too many inpatient options. Not sure where people go for inpatient treatment, but I can see how
Mhm.
that would be more beneficial.
Yeah, I think that I would like to see, I think for me personally, now that we're having, we're talking about this, I would like to see a little bit about the treatment outcomes in inpatient versus outpatient. Um, but I think in the city right now, it's pretty clear at this given point that we're all feeling the stress and the overwhelm of the addiction issues in the city. Mhm.
Oh, yes. Yes,
Mhm.
we are.
We are
Say the say the least. And I know it's a big ticket that's going to impact this upcoming election
100%.
in
Yeah,
November. All of our elected officials need to talk about that plan because we need to see something.
we do.
You need to.
And I also will add to, like, I do think, I don't know if that we talked about this, but there have been examples of other urban cities that have implemented successful harm reduction strategies and have really almost, I wouldn't say eradicated, but have really successfully implemented things that we have seen that have tried to be implemented in San Francisco, but maybe not unsuccessfully, but, like, not in the ways that it is that we've seen, and I think the pressure is definitely on because resources are being allocated to that. And then you have the other side who is like, of course, the thought is, well, if harm reduction then is unsuccessful, then we need to go back to what we think works, which is police and prison.
Right, lock them up. I'm like, is it
Mhm.
the lock them up? Because I feel like that's where we're heading back to. Because we've
And
tried
that
a
feels
little
really
bit of
scary.
everything. We've tried a little bit of everything. I don't know if it's we don't do it long enough, or the
That's
people that
also
are
very possible.
implementing. There's all
Mhm.
kind of aspects that go into a lot of the failed approaches.
Mhm.
Do you have an example of what you've seen as in the other states that is
It wasn't another state. It was, I believe it was, ooh, I don't wanna get it wrong.
okay?
Portugal. It's possible. It was another country
Okay.
where it was just completely overrun by overdose and addiction. So that's what made this so interesting because they really had, like, safe injection sites, needle exchange, and counselors. So I'm like, "Oh, that's sounding really familiar. Okay." And really saw a huge decrease in the number of overdoses. Um, but as we know, I mean, San Francisco is a different city, and there's a lot of people, and the cost of housing and the cost of living is really high. So then I'm starting to think, okay, so then there are, of course, other factors at play here that um, may or may not, there definitely for me needs to be more research done. But that was something that caught my eye.
Right. I just, whenever something doesn't work, they often, people are quick to blame the individual. But having been a city worker or an employee of the city, because a lot of these times the programs are executed by city employees or like nonprofits. And, we spoke a little bit before about, maintaining a continuous relationship with someone as they're going through something, and with the turnover that
Hmm.
happens, in these nonprofits, um, and even with the city employees, I know that has to play a role in it, not having a continuous relationship, not having someone there to hold you accountable or to guide you along the process. And so there are so many different factors that go into play that also, need to be considered, as implementing these type of programs is the staff that's going to be on site, making sure that they're in it and they understand why they're there.
Yeah. I mean, and then I think we talked about this briefly, but of course, you're talking about systemically making sure that workers are taken care of, their families' needs are met, they're having work-life balance, like, their mental health is also, like, you need to be resourced enough if you're gonna be having a high level of care that you're giving.
Trauma informed
So,
approaches.
yeah, 100%. Yeah, like, that's a really high level of care that's being given out, so then that means that you're gonna need to have a high level of care.
Mhm.
Um, you're gonna need to feel taken care of. Mhm.
Yeah.
And actually be,
Or
not
else
just
we're gonna
feel,
keep having
be.
turnover.
Yeah, that's true. Mhm.
It's true. It's like, again, a comprehensive approach to how we are going to deal with things. And so, with that, we talk about the role of communities, of families, of employees, city employees. But how can we all, collectively, um, what's the best way to say this? And really just like family and community members. Let's just start with families and community members. Let's leave city workers and employees and staff out of the picture. But that mental health impacts your family, your household, the community, your school. But for those that are not educated, aware, but not so much educated, how can family and community be supportive to someone that is on their healing journey?
I mean, that's such a good question. And I mean, I really see this as a multi-step process on the other side. Um, but one is get your own supports. Like, make sure that if you're having a family member that is going through uh, an episode of mental health, that you're getting support for yourself. Um, you can also think about family therapy,
Mm,
um, because thinking about the system, like if everything is one way and you know it to be one way, when one thing changes, the rest of the system is really going to try to pull to keep it the same. And so that's why it's really important to like work with the whole family system, I think, and then the community system as well. So that, and I'm not saying I think the only answer is to go to therapy, and there does need to be psychoeducation because if a person is experiencing um, an episode of schizophrenia and they're having psychosis and their family really isn't understanding what's happening and they're saying, okay, like just go to work or just like go to the back room, then that's not going to be helpful, right? So then really understanding like this is not a will or a skill issue, like this is like this person needs a higher level of support. So psychoeducation, getting your own support. And then the other thing too is like I think connection to each other is really important here. So if we're talking about stigma, shame around accessing services, then one of the things about shame that we know to be true is that, like, once you shine a light on it, it kind of loses its power. So when we begin to share stories about hardships that we went through or that we know somebody that we know went through with each other, then there's like a connection that can be made there. Like, oh, I'm not the only one actually. So the shame might still be there, but it's less powerful. So hopefully we can like mobilize each other to take action around. You can have support and my family member can get support and we can have an understanding of actually what's happening.
yes. Yeah, totally. Yeah, that definitely makes a lot of sense. I know that, I've talked to community members that want to create an impact, that just may not know how. Um, some people want to volunteer. I know like barbers
Mhm.
that have opened up their shop for like men talk to
I
where they'll
love that.
community group. Shout out to Craig. He's a barber in Lakeview. His program is called, I want to say it's called Harambe.
I love
And
it.
men come in, they get their free haircuts, and they're just able, to talk freely about what's, bothering them. And then, just getting a haircut can change your mood and the way you
Yes.
feel about yourself, which may trigger you to continue forward on your healing journey, whatever. But um, there are so many people that are, just trying to create an impact or awareness with what they have. And so
Mhm.
I definitely, want to acknowledge and salute, those people. And, if there's any way that, I can provide information or ideas to help other people create impacts, um, that's what this podcast is here for. The series
Mhm.
is here for to, to bring awareness and things like that. But have you seen anything along the lines in your community of people doing the best they can with what they got?
Yeah, and I mean, I really wanna uplift this point, like, if there's anything that anybody takes away from this entire conversation is what you're saying right now, and I feel like this is probably my biggest takeaway from the Latino Studies program at San Francisco State. And shout out to Professor Felix Guri who helped start the Clínica Martín Baró, which is he kept sharing this with us, which is, you know, community medicine, this idea of community medicine. And he's like, well, what do you think that means? And he's like, well, we have our own remedies for certain things, right? Like, how many times your parent call your tia, your auntie, and say, like, oh, so and so has this. Like, what would you do? And how important it is to feel that you have agency and empowerment within your own system. So, like, that barbershop talk, that connection to other men, that haircut is just as important, if not more important than like the Western frame of talk therapy, right? Like maybe not the only thing, but like that is so, so deep to me to really be like, okay, just to drive that point home. Like I love it so much because it is actually so healing. So just because it's not therapy doesn't mean that it doesn't count. So, like, we have the programs where we, like, get together and listen to music and dance, or, like, we have like medicine circles that we participate in with our community healers, drumming, dancing. Like you see our cultural festivals, like we got jazz festival, we got carnaval. So we have places where our communities come together and experience joy and connection. And that is so healing. And like when those things happen, like when we can witness joy in each other and share in those moments, then trust can be built and then stories can be shared and, like, that is truly also where healing takes place, like, in addition to other things, of course, but, like, yeah, we are out here, like, giving food out, having circles, like, talking about these things that are impacting us. So I love that you shared that.
Yeah. And I think that people should know that going on this journey, sometimes you don't have to be alone. It's always good to go
Mhm,
through it with other people because hearing those stories of other people and talking to others, you can see how they overcome. Because there's no, as you know, there's no like right or wrong way to, go along this healing journey. It's the best fit for, what's right for you. And
mhm,
hearing how other people go along, you can adapt things to your life, adapt habits, rituals, um,
mhm.
other people's, processes of how they heal and hear what other people are doing. And then just hear that you're not alone in this process, that somebody probably sitting right next to you is going through something just as crazy and probably needs you just like you need them. So those healing circles, I'm always pushing for support groups, healing circles,
Mhm,
getting together with like-minded people, to help along the journey is always just a good thing as well,
mhm. Yeah.
definitely. So do you have any closing words? I really like everything that you just said. My final question was just about how can listeners get involved and support mental health initiatives for the Latinx community? And you kind of just talked about, a little bit about, what's out there, the support groups, the
Mhm.
cultural, music with the drumming and the beats that can just radiate in your body and take you to another level.
Yeah, I
Just
mean, yeah, I thankfully where I live, there are, like, some powerhouses. I'm sure that I'm gonna miss some. Of course, we got my kid crying in the background. We have Instituto Familiar de la Raza, which is in the Mission, so IFR. There is where I came up through Clínica Martín Baró, which is like came out of San Francisco State joint with UCSF that serves undocumented, uninsured, uh, Spanish speaking immigrants. And they're doing big things. So they pop up, I think, every Saturday. So they're also in the mission and offer mental health services as well. So places that like you can learn more about, promote to people who need it, donate, participate um in their events. There was also one that I was thinking that I can't remember. I know I'm missing some heavy hitters. Um, but I think those are the two that really like come to mind when I'm thinking about mental health. Um, there's more. I know there's more. So maybe what we can do is I'll get you a list and then we can include it in the show notes. Mhm.
Yeah, I was gonna say I'll add it to the description part of the
Mhm.
video. And then also as part of this awareness campaign, we have a website that
Oh, that's right. Oh,
has
yes.
links. Yes. Oh yeah, because Claudia is on my advisory board as well for this project. So I'm very, very grateful.
Oh, I also say too, there's, oh, Jessica out in Oakland. Okay, I know this is not the city, so never mind. I'm gonna just take that back.
Oh, that's okay, because a lot of people work in San Francisco, and may get, have access to this video or, the website and could really use services in Oakland. So you can include or
Okay,
say.
great. So I will give you her name because they're doing dope stuff out of salon and community space with therapists and circles out in Oakland too. And so I would love to have something like that here, like a brick and mortar spot that folks can come to, and it'll be like a hub. That would be so tight.
Yeah, well, you speak it and it'll come to be. It'll definitely happen for sure. So as we close out, is there anything, any final words that maybe you want to say that I didn't touch on, or any last points? I feel
I
like
mean,
we
I think we
touched.
covered a lot. I mean, definitely you touched on so many things, and I just want to thank you so much for having this conversation, putting in the work to bring the awareness. And I think that that's definitely like the one of the most important steps here is just know like what you said. You don't have to be alone. You don't have to do it alone. You're not alone. Um, and we're out here, right? Like all of us trying to figure it out. And like you deserve to get help. Like you deserve to be supported. Um, so yeah.
Wonderful, 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 wonderful. So thank you again for joining me on this journey of educating San Francisco on our services that we have here in the city, just ideas on how to engage in your community, and of course, where to go and get mental health treatment, mental treatment of mental illnesses. So thank you again.
Thank you.